Hello everyone, Rebekah here, and today we're going to be doing a Pilates mat workout. As you can see, I've converted my reformer into a mat so that we can all work out with the same equipment. You don't need any extra equipment besides a mat, or you can even use a blanket or a towel, or if you have a carpet, that works fine as well. And then we'll go ahead and get started. So let's come all the way onto our backs. You can place your hands right on the lower part of your abdomen. Your belly meets your pelvis, and we're going to take a couple breaths to start. So taking a deep breath in through the nose, and then audible exhale out through the mouth. And keep your breath and see if you can notice how your exhale helps you to release in the shoulders, in the neck, in the lower spine and the feet. You just want to feel a little more integrated into gravity's pull. You can place your hands back down by your side, and we'll start to add a little movement of the pelvis. On your next inhale, you're going to anteriorly tilt the pelvis or take an arch, and then exhale what we call a posterior tilt or an imprint of the spine or a tuck. And essentially you're sending your tailbone down into the mat, creating more space under the lumbar spine. And then on your exhale, you're decreasing that space and sending the pubic bone up towards the ceiling. If you can keep using your breath to help release in the back of the jaw, in the back of the neck. And just start to notice the wave-like capacity of the spine. So as you mobilize the pelvis, you're also mobilizing the cervical spine. So the chin is moving down towards the clavicle as you arch. And then as you exhale and tuck, the chin moves away from the sternum, away from the chest. And you don't have to force it, it just happens naturally. And let's do one more set forward and back. And then come to your neutral spine, and you're going to gently press into the left foot to dip the pelvis over to the right. And then press into the right foot, dip the pelvis to the left. And as I do this, I'm trying not to come onto the outer or inner edges of the feet. I'm trying to keep the feet stacked and just mobilize the pelvis as far as it can go. Just a reminder to keep your inhales and your exhales nice and active. And then take one more. I'm going to start by pressing into my left foot to dip the pelvis to the right, and then I'm going to move into circles. I like to start with an arch, so I feel the chin come closer to the chest, tail into the mat. And then over to the left side into my tuck. My chin falls away from my chest. And even as I dip to the right and to the left, my chin is following in that cyclical pattern as well. And last one to the right. And then pause in the center and we shift to the left side. Good. Soft in the back of the spine. And finding the deep circles of the lower abdomen, also of the upper spine. And last one. And then pause in the center and take the pelvis back to neutral. Adjust the feet if they weren't underneath the hip sockets already. We're going to start with some progressive bridges. You're going to start with an inhale. I like to place my hands on my hip sockets. And I'm going to exhale, sort of like to pinch my fingers, and then keep tucking the pelvis. And I'm just going to go halfway, and then exhale. Focus on deepening the pelvic floor as you come back down. Inhale at the bottom, release the glutes, release the hamstrings. Exhale, find the pelvic floor, and then tucking all the way up and in. Good. Again, pausing halfway. Exhale back down. So as much as you're going to feel the glutes and hamstrings, we're really targeting the low abdominals to deepen on our way up. So I deepen, 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 and tuck and tuck and tuck. And then I slowly lower back down. Okay? On the way back down, you want to articulate even more. Let's do 2 more, progressively getting higher each time. And let's take 1 more, and then we're going to hold at the top. So exhale. Good. And then without shifting in the pelvis, I'm going to lift the right heel and lower. Lift the left heel and lower. Good. Keep those glutes meeting the hamstrings. And switch. And switch. And switch, like we do a little prancing at the ballet bar. And let's go for 4, 3, and 2, and 1. Slowly lower both heels and take the pelvis back down 1 vertebrae at a time. Good. Deep breath in. We're going to lift the right leg up to tabletop. Exhale. I'm just going to take the whole spine up. Inhale. And take the whole spine down. And I'm thinking of reaching my tail back down to the mat to keep a neutral spine. Exhale, lift. Inhale, lower. Let's go for 4. And 3. Last 2. And 1. We're going to hold it up. We're going to do little pulses just for 8, 7, 6, 5, 4, 3, 2, 1, and then slowly lower back down. Nice. Let's switch to the other side. Take a deep breath in. Exhale, press into the whole of the foot. Hips go high and lower. See if you can keep the rib cage closed here. Exhale. Last 3. And 2. And 1. We hold it up, little pulses for 8, 7, 6, 5, 4, 3, 2, 1, and slowly lower. Nice. Bring both feet back down. Let's extend that right leg all the way out. And I want you to place your right hand especially on that right side of the pelvis, right where your lower abdomen is. You're going to take a deep breath in. On your exhale, engage in the abdomen. You're going to draw that right knee up, adjust to the tip of the toe, and then back down. Inhale to release the leg. Exhale, deep abdominals, pull up. Inhale, extend and flex. Good. As you start to deepen your exhale, you can begin to take that right toe off. And again, inhale. Let's go 3. And 2. Last 1. Right away, switching sides. Inhale to lengthen. Feeling exhale, abdominals on the right side, on the left side, excuse me, pull in. But as you extend that leg, just start to notice if you're mobilizing in the pelvis or if you're able to maintain that neutral spine. I like to think of almost imprinting to counter that natural imposition to want to arch. Halfway there, we go for 4. And 3. 2, 1. Good. We start to extend the legs slightly off the floor for this next variation. You inhale, you're going to lift, exhale, and dive it in. A little bicycling with the right side. Inhale, exhale, and point to lower. Let's go 2 more this direction. Extend all the way out first, and then we reverse. Inhale, exhale. And 1 more. Lower all the way down, and then drag it in. Nice. Opposite side, flexing in the ankle. Exhale. And one more. And reverse it. Inhale at the bottom. Exhale. Nice. Last set. And flex to lower. Drag everything all the way back in. Nice, everyone. We're going to take that right leg out, and you're just going to point and flex. As you're doing this, the pelvis will want to go with the leg. So actually you want to counter the pelvis and then return to neutral. A little imprint and then neutral. We go for 6 and 5 and 4 and 3. Long toes. 2 and 1. Same thing on the other side. Take a deep breath in. Exhale, lift. Inhale out. Exhale in. Inhale to imprint. Exhale. Release. The smallest movement, but the same thing we did on the mat. You want to resist what the pelvis is doing and what the leg is doing. Last 4. And 2. Last 1. If we do the same thing in external rotation, so we're going to start on the little pinky toe, and you're going to start in an attitude, and this time I'm going to flex and point in, and flex and point in, and for 6 and 5 and 4, 3 and 2. Last 1. Reset and flex and 2 and 3 and 4 and 5 and 6. Nice, everyone. Open up those knees all the way without dropping in the ankles. You're going to come into like what we would consider a first position. Navel's going to stay in. You extend both legs out. Keep drawing the navel up and in to flex and point. Draw into the glutes. Exhale, navel stays up and in. If you like to, you can add some arms. Inhale, keeping the ribs shut. Exhale and close. Inhale. Exhale. Good. Last 4 and 3 and 2 and 1. Good. Bring everything back to center. We're going to start to add a chest lift here. So on my inhale, I'm going to keep the arms where they are. Exhale, I'm going to draw the chin in towards the chest and bring the right knee in. And right away switch. Exhale. Feel free to bring the arms down a little bit, and you can open up the fingertips. You can really think of this as your port de bras, so it really comes from the back. And this is your pre-extension, so deep core. Good. Last 4 and 3 and 2. Good, 1. Nice. Take both arms in high fifth. Elbows are nice and bouncy and wide. Try not to let them come in or do something else that's a little odd. Take the right leg up, then the left leg up. Your exhale is going to bring you up. You're going to stay up. So I'm going to lower both feet down and lift. Good. We do 4, just holding the arms. And 3. Good. My button is choking me. And 2. There we go. And 1. Then I'm going to add the arms. Okay, so bring the arms up and down. And countering what the legs are doing. So let's go 4 more. Exhale. Inhale. Last 2. And 1. Good. Lower everything back down. Nice. Let the arms come all the way to a relaxed position and take a little arch of the spine. Deep breath here. And exhale, tuck. Nice. We're going to keep moving into some chest lifts. And I'm going to take the hands behind the back of the head now. Feel the elbows at first press into the mat so you can really feel those shoulder blades activate. We're going to start with a neutral spine. I'm going to inhale at the bottom, fill the lungs, and then exhale, curl the head and chest up. I'm going to hold here. I'm going to tuck in the pelvis and then arch. And tuck and arch. 2 more. Take an inhale and exhale, lower. Good. 3 more sets like that. Exhale to lift. Inhale. Exhale. One more set. Good. And lower. Exhale. Inhale, arch. Exhale, tuck. One more. And bring it down. Last set, everyone. Deep breath in. Exhale, deep abdominals, pull in. Inhale, arch. Exhale. I'm shaking 2. One more. And bring it all the way down. Again, bring the legs out. You can interlace the fingers and just lengthen the spine all the way out. All right, let's draw the arms down by your side. Bring the pelvis back to a neutral spine. One option to do here is to bring that left knee in, which I'm going to do a little bit, because it's difficult for me to lengthen both legs sometimes with a big pregnant belly. I'm going to start here and then slowly work my way to an extension. On your exhale, you're going to lift that right leg up towards the ceiling. We're going to start with some hip circles. So I'm going to let that right leg cross over towards the left. Exhale and lift. And you're going to try to maintain stability in that left side. Deep breath in. Exhale up. Good. Deep abdominals pulling in. You have 2. And 1. Reversing for 6. And 5. And 4. 3. And 2. and 1. Good. Nice. Go ahead and bend that right knee, and we'll do the same thing on the other side. Feel free to extend the right leg all the way or keep it at a slight bend like I'm doing. We start with a big point in that left foot. You go across, 1. Pressing into the right foot for 2. And 3. 4. And 5. And 6. Reversing. 2. And 3. And 4. And 5. And 6. Go ahead and bend that left knee. Nice, everyone. Take a deep breath in and exhale, release. All right, let's come back to our chest lifts. We're going to start to add on. It's going to get a little more complicated, okay, and a little bit tougher on the lower abdominals. Right. Deep breath in at the bottom. Exhale, curl the head and chest up. We're going to take both legs long up towards the ceiling. I'm going to lower the right leg down and lift. Stay on the right for 4 and 3. You can always lower the head and chest for this. And 2 and 1. Then you're going to lower the left. One more. Good, both legs up, lower the head and chest. Take a deep breath in, we go right away up, exhale. First the left leg lowers. Good, then the right leg lowers. Last one. Both legs up. Bend the knees. Bring everything back down. Nice, everyone. That's a tough one. For this one, we're going to keep the chest down. You can always add a chest lift if you want a little bit more in those upper abdominals. But for baby's sake, I'm going to keep the head and chest down. All right? We start again with the legs up towards the ceiling. We're going to go into what's called frog. So I'm going to lower about halfway and then bend the knees in, exhale, and point. Good. Keep thinking of imprinting the lower spine. This is hard on the lower back. You can place hands underneath and then exhale out. Good. Last 3. And 2. And 1. We're going to open the legs to a second position. Same thing. Flexing and pointing. Last 2. And last 1. Nice. Internally rotating now. I'm going to flex and point. Last 4. And 3. And 2. And 1. Good. Legs come up towards the ceiling and slowly back down. Good, everyone. Let's come onto our side And then we'll slowly make our way all the way up to a seated position. We're going to work the core just a little differently. So instead of rolling up, we're going to start to roll down. All right, go ahead and flex in the ankles. Feel free to bend the knees, grab onto backs of the thighs here. If you would like, you can grab onto a little first position, feel the shoulder blades help you engage. We're going to exhale to tuck in the pelvis, and then slowly come back up. Exhale, and up. Nice. Feel free to go a little farther. And up. Last 4. And 3. And I'm going really small. 2. And 1. Nice. And then we're going to come all the way down onto our elbows. Bend those knees into the chest. Okay. A couple options here. You can come all the way down again. And I'm just going to really press into my elbows so that I stay lifted. Okay. I'm going to take the right leg up to tabletop. And I'm going to just push it out, open to the side, come all the way back in to parallel. Right away switching. Press into the right foot, out, externally rotate, keep pushing into the right foot, parallel, and in. Good. One more set. And then come all the way up back to seated. We're going to do some side lying work now. Good. We're going to start with our deep inhales and exhales, and I want you to feel a little space underneath the waist here. Good. And see if with every exhale you can pull your waist away from the mat. We're going to start with some internal rotation. So internally rotating, knees not together.